Hello everyone, welcome back to my video. Today let's discuss telephonic services, which is a topic under CPT evaluation and management chapter, which comes under non-face-to-face visit, and the code ranges between 99441 to 99443. So this is a paragraph which is given in our textbook. Telephonic services. Telephone services are non-face-to-face evaluation and management services provided to a patient using the telephone by a physician or other qualified healthcare professional who may report evaluation and management services. So telephonic services simply means that it is a non-face-to-face service which is provided through phone, or it is a telephonic service, and this can be done with the patient as well as the guardian of the patient. If the patient is unable to make a call, then the guardian of the patient makes a call, then it is a telephonic service. So the next line is, these codes are used to report episodes of patient care initiated by an established patient or guardian of an established patient. Next one is the guideline. If the telephone services ends with the decision to see the patient within 24 hours or next available urgent visit appointment, the code is not reported. That is, if a patient had a telephonic service and if he or she visits the provider within the 24 hours, we cannot code it as telephonic services. But if the visit is only after 24 hours of telephonic conversation, then it is considered as a telephonic service. That is, if the patient had a telephonic service and is coming to visit the doctor or the provider soon after the telephonic service, then we don't call it as a telephonic service, we consider it as a office visit. But if the patient comes after a 24 hours after a telephonic service, then it is considered as a telephonic service. Next one, likewise, if the telephone call refers to an E&M service performed and reported by that individual within the previous 7 days, either requested or unsolicited patient follow-up, or within the post-operative period of the previously completed procedure, then the service is considered part of that E&M. So here it states that if a patient visits doctor and within 7 days, if he makes a call or has a telephonic service, then it is not considered as a telephonic service. So when is telephonic service considered? If the telephonic call is after 7 days of the visit, then only the service is considered as a telephonic service. That is, if a patient visits a doctor in the clinic and soon after that, within 7 days, if he or she, the patient makes a telephonic call, then it is not considered as a telephonic service. But if he or she calls after 7 days, then it is considered a telephonic service. Likewise, if a patient is in post-operative period, that is, if he or she is in a post-operative period of a surgery or a procedure, then if he makes a call, then we cannot consider it as a telephonic service, because telephonic services are a routine part of post-operative call or a post-surgery care. So we cannot call it as a telephonic service. So next one, do not report 99441 to 99443 if 99421, 422, 423 have been reported by the same provider in the previous 7 days for the same problem. For telephone services provided by a qualified non-physician who may not report evaluation and management service, example, speech language pathologist, physical therapist, occupational therapist, social workers, dietitians, see 98966 to 98968. So always while coding, make sure that you go through the brackets and you have chosen the codes and coded correctly, because in brackets there will be do not report or use in conjunction with, that is, we sometimes we cannot code two codes at the same time, so make sure that you go through all these brackets before coding. So let's look into the codes. 99441 telephone evaluation and management service by physician or other qualified healthcare professional who may report evaluation and management services provided to an established patient, parent or guardian not originating from a related E&M service provided within the previous 7 days, nor leading to an E&M service or procedure within the next 24 hours or soonest available appointment, 5 to 10 minutes of medical discussion. So in the code description it states all those guidelines, that is only the telephonic service is only considered if the patient visits the doctor only after 24 hours of the telephonic service. Also if the patient calls the doctor only after 7 days of visit, or if he or she is not in the post-operative period only, we can consider these telephonic services. So here we only have to look for the time, that is 5 to 10 minutes of medical discussion. So if a telephonic service is conducted within 5 to 10 minutes, then we will have to call 99441. So next code 99442 is for telephonic services, 11 to 20 minutes of medical discussion. 99443 is 21 to 30 minutes of medical discussion. So we have to make sure that how much time is taken. If it is 11 to 20 minutes, then we can code it as 99442. 21 to 30 minutes, 99443. Also make sure that you go through every brackets under every code, because in this we can see that do not report 99441 to 99443 when using 99374 to 380 for the same calls. So if in case in any option if 99441 and 99374 are given together, if we go through this bracket only, we will understand that both of these codes cannot be coded together. So always make sure that you go through every brackets under every codes. So here is a question. A 55-year-old established patient requests phone visit. Patient has hypothyroidism and hypertension. Medications are reviewed and refill order is sent to pharmacy. Visit time 6 p.m. to 6:10 p.m. So here a 55-year-old established patient is having a telephonic service and the time is 6 p.m. to 6:10 p.m. That is only 10 minutes of telephonic service is provided. So the code is 99441 because it stands for telephonic E&M service by a physician or other qualified healthcare professional, 5 to 10 minutes of medical discussion. So here only 10 minutes, so we can code it as 99441. Next question, 65-year-old established a patient with multiple comorbidities requests phone visit. Patient has diabetes mellitus and hypertension. Patient complains of headache since 2 days. Blood pressure readings at home indicated 150/90 mmHg. Patient said he did not take his medication for the last 2 days. Physician advised on medication compliance and to recheck the BP after taking medication and to monitor the BP for couple of days. If still not controlled, advised for an in-person office visit after 7 days. Visit time 10 a.m. to 10:25 a.m. So here the patient is having a telephonic service and so many things are said, but we don't have to code everything because we are considering only telephonic service. We have to look into the time of medical discussion. So here it is said that in the last line it states that visit time 10 a.m. to 10:25 a.m. That is only 25 minutes is provided. So we have to code for 25 minutes. So the code 99443 is for 21 to 30 minutes. So here it is 25 minutes. So it comes in between 21 and 30. So the answer is 99443. Telephonic services provided for 25 minutes is 99443.